Welcome to this brief introductory video on differential diagnosis in traditional Chinese medicine. The Huangdi Neijing Ling Shu assesses doctors according to their ability to diagnose their patients. In Chapter 4, Huangdi comments that a doctor who can diagnose a patient just by looking at him is the most skillful. The doctor who can diagnose by using the pulse, although highly esteemed, is rated second. In third place is the doctor who interrogates the patient. The reality of the early times was such that because doctors had a considerably lower status than their rulers, they were forbidden from touching their illustrious patient and were certainly not expected to spend time interrogating them. Despite these extremely harsh criteria, Huangdi continues by asking for instruction on how to diagnose a patient by observation, pulse taking, and questioning. A differential diagnosis consists of determining the possible conditions that can give rise to the signs and symptoms exhibited by the patient. In traditional Chinese medicine, differential diagnosis mainly refers to syndrome differentiation, whereas in Western medicine, differential diagnosis is mainly focused on diagnosing disease. Diseases may have different manifestations at different stages. These manifestations can also vary according to the person's natural physique and the state of their immune system. In dealing with syndromes, TCM treats the current state of a patient's disease. Because of this, there is a saying in TCM: the same disease can have a different treatment, different diseases can have the same treatment. This may further be complicated by the fact that there is often a primary syndrome, which is called a ben or root problem, and one or several secondary disorders called biao specific to a patient. If the clinical manifestations of the secondary syndrome are mild, the physician should just focus on the primary disorder. If the secondary symptoms are severe, both the root and the secondary disorder should be treated at the same time. In either case, this will result in the need for changes in herb dosage or the addition or removal of herbs in a formula. In TCM, diagnosis and consequently the success of treatment is thus heavily dependent on the skill and experience of the physician. In summary, the patient's signs and symptoms lead to a diagnosis of a syndrome by the doctor. The syndrome, which describes the state of the disease and its mechanism in TCM terms, allows the doctor to determine a treatment principle. This will lead to the prescription of a formula suitable for this syndrome, which may be adapted to deal with other issues the patient may have. There are a number of schools of thought for approaching diagnosis and syndrome differentiation. Today, most TCM physicians are guided by the approach known as the 8 principles, although they will often use elements of the other approaches shown on this slide. The 8 principles give the most basic concepts that need to be considered for the diagnosis of a patient. They are yin and yang, interior and exterior, deficiency and excess, and hot and cold. These are mainly self-explanatory, and perhaps what is unusual is how yin and yang fit in, as the remaining 6 principles are essentially specific manifestations of yin and yang. This consideration serves us as a reminder to consider yin and yang in all their forms, which can range from the gender of the patient to general ideas such as upper and lower. In a diagnosis, the 8 principles are usually considered with respect to one or several organs, to one of the sanjiao, or 3 burners, or to a general part of the body, and this may include a description of its state. Examples would be kidney yin deficiency or liver qi stagnation. An explanation will refer to what could be called a form of qi. This might be qi or blood, or a pathogenic form such as dampness. Examples could be deficiency of both qi and blood, or retention of damp heat. The diagnosis could include a verb describing the activity of various forms of qi. This can sometimes be an analogy to the activity of an army dealing with an enemy. Examples of this could be wind heat invading the lungs, or failure of the spleen to govern the blood. Classically, patient diagnosis is conducted using 4 methods. 1 is inspection or observation. 1 is listening and smelling, or auscultation and olfaction. 1 is inquiry or interrogation, and che is palpation, usually with respect to the pulse. Inspection starts with observing the patient's posture, way of moving, and general body language to look for clues about their jing, qi, and shen from their spirit, vitality, and mental state. The physician may get an intuitive feeling about the patient's state as soon as she walks in, but this nevertheless needs to be backed up by other clues. The physician should note as many physical features about the patient as she can, paying attention to the face, hands, and tongue. She should assess these characteristics, taking the patient's gender and current circumstances into account. In addition, she should observe the patient's skin color and luster and see if they are sweating. The physician should listen to the patient's articulation, voice, and breathing. Certain diseases are associated with a characteristic smell. By smelling the patient's breath, a physician may determine the presence of an underlying pathology. The physician should of course question the patient about their current symptoms. This should be complemented by questions about their medical history and current lifestyle. If appropriate, there will be questions about the patient's urination and defecation. Mature women will always be questioned about their menstruation. Palpation today is most commonly associated with taking the patient's pulse at the wrist. The classics make reference to pulses at other areas of the body, notably around the Renying point on the neck. Another form of diagnosis involves abdominal palpation. This method of diagnosis is very popular in Japan. The 8 principles I mentioned earlier were proposed by Zhang Jingyue, who was an eminent physician towards the end of the Ming Dynasty. He also composed the 10-question song to summarize the key questions a doctor should ask in a consultation. This is a useful poem that students in China learned during their TCM studies.
1问寒热，2问汗，3问头身，4问便，5问饮食，6问胸，7龙8可具当便，9问旧病，10问因，在兼服药参机变，妇人犹必问经期，持宿必崩皆可见，在天片语告儿科，天花麻疹全占验。
First, ask about heat and cold. Second, ask about sweating. Third, ask about their head and body. Fourth, ask about their stools and urine. 5, ask about food and drink. 6, ask about chest. 7, ask about hearing. 8, ask about thirst. 9, ask about old diseases. 10, ask about their cause. Ask if they're allergic or have adverse reactions to any herbs. For women, you must ask about the timing of their periods, whether they are late or early, scanty or flooding. For children, ask if they've experienced smallpox or measles. As smallpox has now been eradicated, a more pertinent question would be whether the child has had chickenpox. This list can provide some useful guidelines for diagnostic questions for a student TCM physician. As a final addendum, I would like to share some of my subjective experiences. A TCM consultation is fairly brief in China and much cheaper than in Western countries. The consultation may take 10 minutes in a busy clinic. In 2014, when I left China, the cost could range from $2 in a small clinic in the suburbs of Beijing to $100 for a doctor with a reputation. Results, I found, did not necessarily correspond to the costs. I was successfully treated for a serious chronic cough that was getting worse for a very modest fee, but also witnessed patients paying much more for unclear results. Outside China, the first TCM consultation may last an hour, and the patient may be required to fill out an exhaustive questionnaire. The consultation fee may be equivalent to that of a Western doctor and is rarely covered by any form of insurance. In China, most physicians follow much of the methodology I've described in this video. In certain cases, particularly if this involves pregnancy, some TCM physicians will ask for Western lab results or echographies. In the country, there are still doctors who will maintain their individual family traditions. Some purist TCM physicians still prescribe strictly according to the Shanghan Lun and the Jingui Yao Lue. All of these physicians would fall into the category described as practitioners according to the Huangdi Neijing. There are a number of TCM physicians who will just take the patient's pulse and on that basis will make a prescription without making any inquiries. Some of the physicians I encountered could on many occasions successfully determine if a woman was pregnant just from their pulse alone. However, other examples of their diagnosis were not necessarily as successful. In Chinese clinics, no physicians rise to the challenge of diagnosing by just observing the complexion. This may occasionally happen if you consult a physician at a Taoist temple. I have no personal experience of the success of this kind of treatment. Thank you for watching this video, and I hope you'll join me for future videos in this series.